Mohs surgery is a type of very specialized precise surgery where we are looking at removing all of the skin cancer. Generally, it is typically the most effective means of excising the skin cancer, mainly because these skin cancers grow like icebergs. So you sort of have this bump on the skin that you can see with your naked eye, but what you don't see are the roots underneath of it, like the roots of a tree or the roots of, the parts of an iceberg that's underneath the surface of the water. And so what our goal is to go around the whole skin cancer, around the perimeter, and then underneath too, and make sure we get all the roots out. And then the very special part about it is that it allows us to conserve as much tissue as possible. So in areas like the nose or the eyelid or the mouth where we really don't have very much skin to work with, we want to try to minimize the amount of surrounding tissue removal that we have to do. Skin cancer is the most common cancer in the United States right now, and it is on the rise, and it's due to many factors that contribute to it. Often years of being in the sun after a long time. The UV radiation can actually cause damage to the skin and the tissue, and when there's not as much turnover, then a skin cancer can develop, and oftentimes that presents as a non-healing sore or a bump that just won't go away, and it might bleed, it could itch, it could be painful, and oftentimes that will prompt an individual to come and seek evaluation, either by their primary care doctor or by our general dermatology clinic here at the VA in Iowa City. At that time, we'll do an exam, we'll hear about the story associated with the bump, how long it's been there, if they've treated it at all. And at that point, we would generally take a biopsy, which is a sample of the tissue at that time to get pathologic confirmation of what the diagnosis is. At that point, once we get the biopsy results back from the patient and confirm that it's a skin cancer, then if the skin cancer is located on the head or the neck or in an area where we really need to preserve tissue and minimize the extent of skin that we're taking, which is generally the head and the neck on a person, then we will have them scheduled for a Mohs surgery. And so what that means is we take about 1 to 2 millimeters of skin around the visible bump, and bring that to our lab and then mark it out with different colored ink to specially determine exactly where the skin cancer is. And then that actually gets turned into slides, which then we as the Mohs surgeon will read and interpret whether there's still skin cancer left. If there is still skin cancer left at one of the margins, we precisely mark with a different colored ink on our map where it is, and then we'll go back and take only where that skin cancer is still present. So we can take little by little, layer by layer to make sure we get it all out. Because it is such a highly specialized field, this kind of precise surgery is often not available in the community. And so because of that, you'll often have to get a standard excision where wider margins and more skin is taken off. It generally results in a much bigger scar. Also, if 100% of the margins aren't being checked, there's a much higher rate of the cancer coming back. We also take great pride in our reconstructive skills. Like, we've done extra training and fellowship training in plastic surgery reconstruction techniques to be able to put it back together in a way that still is cosmetically acceptable and functionally ideal. So, no trouble breathing and you're still using your eye and things like that. when patients come for their Mohs surgery, it's often a shock and a surprise at how much skin we have to take off. I think oftentimes it's imagined that someone is going to come in just like the day of the biopsy, where we numb it up, shave it off, and then you're kind of on your way, and people are sort of shocked by how long the procedure is and how much skin is taken off, and how big the repairs are, and how long wounds take to heal. And so we try our best to do as much pre-education as possible so that people feel really fully prepared for what's about to come. We have an incredible team who work with talking to the patients on the phone before they come and making sure everybody is involved in the discussion. The people often leave saying it was like the best day that they had at the doctor, which is just funny. I think it's just because we end up having an enjoyable time, mainly talking to the people because everybody is awake during the procedure. And so we get to know them, get to know their story, their family, what they like to do for fun, and it ends up being a pretty good day. The rates of skin cancer in general are proportional to the amount of sun exposure that one has had, and especially for an extended amount of time without any protection. And unfortunately, many of the veterans who've given their life so selflessly, being out and protecting our country, have also exposed themselves to dangers in many ways by doing that, including the sun. I think veterans have a high rate of just exposure being outside. Sometimes chemicals can be, involved in the rate at which people develop skin cancers, and so that can play a role as well. Also, having a lower immune system. So if anybody has a history of a transplant or like a leukemia or lymphoma or something like that, that can also put somebody at risk for developing a skin cancer. These types of skin cancers can really be quite problematic and life-threatening if they're not taken care of. And so the best, Mohs surgery is a wonderful way to treat it, but really the best thing that anyone can possibly do is to just try to prevent the development of these skin cancers. Sunscreen with an SPF of at least 30 to 50 being reapplied every 2 hours is ideal. Also just making sure to, wear a really wide-brimmed hat and cover up in your clothing and try not to be outside during the hours of 10 to 4 p.m., soaking in the sun. Just being really careful about being outside. So someone who's never had a history of skin cancer or a melanoma in the family doesn't necessarily need to be coming for regular skin exams, but surely, being aware of their skin, having the primary care doctor who's trained in dermatology, being able to examine the skin, or a dermatologist look once a year is good. I think that for those who have high-risk skin cancers in their past, every 3 months, we generally, 3 to 6 months, we'll generally follow up. Some things to look for is a bump that has evolved or changed over time, didn't used to be this way. Anything that's not healing is generally a concern for, to seek help and look for that. And by coming in and getting kind of some more information about what is normal, what is not normal, can help you kind of protect yourself and then also protect those around you by being, paying close attention to what might need further evaluation.